but we are training the health professionals how to administer the vaccines. Every vaccine has its unique characteristics, so training is ongoing at the moment.
Very first day in office, and this is the very first task that confronts you. But you also then talked about meningitis. What's the situation with meningitis?
So meningitis has also been detected. That one too was detected, I think, December thereabouts. So as I speak to you now, it is within the Upper West, Nadoli, Kaliu, and Wa municipality. So tomorrow I will go to Wa, Nadoli to have first-hand information to assess the situation and know what we could. That's one too. We are thinking about rapid response team, and today I will deploy the advanced team to the region, and I will follow up tomorrow to have the first-hand information. If there's a need for us to, add another team or add certain logistics, we'll do so immediately.
Interesting response from you on day one. So how different would your approach be to handling these outbreaks like this from the person who has left office? I'm sure you know how he was doing it because of your work at the committee level. How differently would you approach things when it comes to this kind of outbreak, meningitis, cholera, or whatever the disease is?
Well, I promise I will give my utmost attention to some of these situations, because I remember my swearing in. Mr. President was clear about my marching orders that it should be one of my priorities, emergencies and pandemic preparedness. So what we are going to do is that these ones are more or less ad hoc rapid response team because of the exigency of the matter. But going forward, what we are going to do is that we are going to have an emergency and pandemic preparedness framework. So we don't need to wait until there's a pandemic or epidemic or an emergency situation before we roll out a knee-jerk reaction. So what we are going to do is to have the framework where we have surveillance across the country, early detection. So once your surveillance is very strong and your laboratories are also very strong and you do early detection, you cannot prevent some of these things, entirely. That's not possible. But as and when there is an outbreak, you detect it quickly, and when your management is also strong, and the last aspect is vaccination and education, we'll be fine. Yeah.
Well, we'll be watching carefully how you handle this first two tests. But in the meantime, you walked into the ministry and this is what you met. But I'm sure you had other priority areas you were considering kicking off from. What was the priority areas that were on your mind as minister from day one?
Within the 120 days of His Excellency John Dramani Mahama, we are supposed to roll out what we call Mahama Care. That's Ghana Medical Trust Fund. And this fund, the NCDs are killing a lot of people in Ghana at the moment. And so we want to establish this fund to subsidize chronic diseases in this country, cardiovascular diseases, kidney-related diseases, cancers, and what have you. So it is one of the things we should be able to establish within 120 days of His Excellency John Dramani Mahama. And I'm working tirelessly alongside with this emergency. We are also looking at free primary health care. At least if you go to the chiefs, health centers, clinics, every Ghanaian should have access to free primary health care. It's one of the things that I'll concern myself with so much with the going forward. One aspect that for me it is also a timing bomb is the unemployment in the health sector. We have a lot of health professionals at home who have not been employed. And so sometimes it also has to do with the implications on the wage bill. How many we have a capacity, how many we can take at a time. So we'll look at how many, having the optimal workforce in this country and looking at how we can facilitate the migration of the SSs that we have as a country. So I will also be looking in that direction. And chips compounds, construction of more chip compounds, and we'll also be gravitating towards medical tourism. Medical tourism. It's one of the reasons why His Excellency John Dramani Mahama built the University of Ghana Medical Center. But unfortunately, we have not been able to optimize the use. We will look in that direction as well. So there are a number of issues we are hitting the ground running at the same time.
Lots of things to do. In fact, big issue, unemployment in the health sector. Have many nurses that are passing out. And there's even a group from 2019 that is still yet to be employed. When you say it will attract your attention, are you talking about putting everybody on immediately, or what's the plan?
No, I would not be that minister who will be promising almost everything, especially the impossibilities. No, I'll try to carry Ghanaians along, but I will be candid as possible. What is expected of every leader is to be candid to your people. So what actually I am going to do is to engage other countries, the UKs, the US, the Germanys, the Barbados, and what have you, so that we'll have that kind of arrangement with them. And then they will tell us the numbers they need per every year. If there's a need for us to let them help us in training some of these people, we will have that arrangement with them, and then we try to facilitate the migration of these professionals. Because, Sena, let's face it, whether you facilitate or you don't facilitate, a certain number will migrate anyway. You understand? And so we have to regularize it well so that the state can also benefit from it. Our people can also get employment. You know that remittance from other countries is one of the revenues we have as a country. Don't you know that?
Yes.
Yes.
Big one.
Yes. So if you're able to facilitate this, the least is that we can get remittances from these Ghanaians who will be working outside the country.
Well,
I guess you all pray.
Oh, we've lost the Honorable Minister on the line. We've lost him on the line. Let's call him and wrap up on this issue. This is the second day, so I'm being cautious not. But because the big thing about cholera is that you need water. Big issue, water is a challenge. Maybe you can get sanitizer. What's the cost of sanitizer? So there are many issues anyway, but second day he's put together his approach is he's put together a response team, regional level, national level, both have gone to work on this issue. Anyway, yeah, there was a question that came to mind, and sorry we lost you on the line. The question that came to mind was that this matter of exporting nurses, you know that it was tried under the immediate past administration. Do you have an idea as to how it worked?
I think, as far as I know, limited number of these health professionals had the opportunity to travel to Barbados. And that's all I know about it. But I think we can go beyond Barbados.
We can go beyond Barbados?
Yes.
I see. Then let me conclude on this note. There are many questions to ask you, but I have to limit it because this is your second day in office. You raise many issues with the Agenda 111 projects. What happens to them? What's the marching orders from President Mahama?
Sena, why would you have mercy upon me? Anyway, so the marching orders from His Excellency John Dramani Mahama is that we will have to complete abandoned and uncompleted health facilities. That is clear. But again, I will be very cautious in promising that we are going to finish 111 hospitals within the 4 years. I'll be very cautious, especially when we have no dedicated sources of funding. You know, the difference between this government, there is essentially John Dramani Mahamad's government and another Dankwa Akufo-Addo Bawumia's government, is that, yes, every government will leave behind uncompleted health facilities. But in our case, when we were leaving behind these uncompleted health facilities, we left money to continue the project. In this case, we don't have any dedicated sources of funding. In the John Dramani Mahamad's regime, we had the Eurojet project, we have the NMS project. So once you are a government and you inherit this project, you just use the money to continue. But in this case, we don't have any money at all. We don't. They have spent about $400 million US, and even per their own calculation, if you are estimating every district hospital to be $18 million. What it means is that if you use $400 and something million, you should be able to complete more than 20. As I speak to you now, not a single one Ekome has been completed.
Not one?
Not one.
When you say completed, you mean that even civil works in terms of the concrete place, the housing, nothing?
The definition of a health facility is not brick and mortar.
Okay.
The definition of a health facility, a hospital, a regional hospital, is not brick and mortar. The definition of a health facility is a brick and mortar equipped with medical equipment, with health professionals. At least, even if you have not commissioned it and you have the brick and mortar equipped with medical equipment, that's fine. But none of these hospitals have equipment. In fact, even the brick and mortar, we don't even have more than 2. You know, so that is, and the ministry is saddled with debt.
Really?
Master, in the coming days, you will hear. Only yesterday, my management met me. I think about 5 top management came to me and they were giving me some brief. Yesterday, you know, we had a lot of tasks. It was my first day in office, so we had to divide ourselves into 2. I was attending a program where the WHO was coming to assess our preparedness towards combating emergencies and then epidemics. So the WHO was in Ghana, so I had to be there. And we had also to go and meet the Minister of Finance. And so now I can tell you that for now, excluding compensations and other things, the ministry is in debt of more than 7 billion.
7 billion cedis?
I mean, I'm telling you that even what I'm talking about is not more than 50% of what we owe. So I've asked them to put everything together for me. It excludes nursing training allowances arrears we have. It excludes those ones. Even at the moment, per the classification of the Ministry of Finance, it's about 2 or 3 items, and that's the 7 billion they gave me briefing on. And that's not more than 50%. This is the ministry I'm walking into. And you see, my style is going to be that, look, whatever I have met, I'll tell the people of this country. And then we'll take it from there. They're not going to complain. It's not going to be complaints. We are capable of handling the situation, but you must know what we are going to do. Everybody knows that the cholera pandemic, the cholera outbreak started somewhere in August 2024. It was not during my tenure of office. But of course, I've walked in with this problem. I can't put my arms and say because it's not my tenure, it didn't start with me, I'm not going to do anything about it. But there's a need for us to know when it started so that people will appreciate what we are doing and where we are going.
I guess we'll be hearing from you.
Why not? You'll be here, especially Radio Good.
Great. You know we like working with you always. But in the meantime, when we were talking about cholera, my social media producer was playing some pictures and videos, things that came up. Water to wash your hand. Big issue. Water is a big issue, but it doesn't fall under you. Sanitation
Okay,
into doesn't necessarily. So how do you tie that into your work?
in the health sector, we cannot do it all alone. It's a multi-sectorial issue. So especially with the local government ministry, because if we don't prevent some of these things, we'll keep fighting and fighting to be firefighting. We must look at our drinking water. We must have portable drinking water. And we do, as you have rightly said, we don't provide water. In fact, in some cases, we have to go there and provide them, use tankers to provide them with portable drinking water. You know, the sanitation. We have to check our environment. You know, so all these things, we should do these things together with the local government, the MMDCs and what have you. So that is why I am going to touch base with these affected areas, then try to engage the stakeholders, the chiefs, the district assemblies, and we all think through it, how we can provide solutions to these situations immediately.
Thank you. Thank you very much for speaking to us this morning. We'll be in touch. Wish you all the best. Honorable Kwabena Mintah Akandor, Minister of Health now. Interesting thing. And for many of them, I'll be watching.